Surgery's in about 5 minutes. How are you feeling?
Super
Did you
nervous.
get a good night rest? Are you really nervous and shaky?
Yeah, okay, I'm joking.
I've never done a post like this before. I am having surgery tomorrow. My implant's ruptured. So I met with Dr. Robert Cohen. He's in Beverly Hills. I'm really excited about it. Oh God, I am so nervous. I did a show, and one of the things that I did was jumping off a bridge. I felt a little snap, but I don't know if it was my neck or my hips or whatever when I fell off that thing. And I've had ruptured implants years ago. Those were a different type of implant though. So this was more like a slow, misshapen look. That's how I really know. And they hurt a little bit. My surgeon that did my last implants, I've had these done a few times, she had just retired. So she referred me to a surgeon who said that she wasn't sure if the actual implant was ruptured, but whatever it was, I had to have surgery to fix everything. Obviously, I didn't end up going to her to do the surgery. I just have a gut feeling about things, and I just didn't feel right about the surgeons that I'd met with till I saw Camille Grammer, who's a friend of mine's Instagram post.
I decided to get an explant because I was just over the neck pain I got from having these large implants.
Talked to her and right away booked a consultation.
As soon as Denise walked in, you just never know, you meet somebody I've seen on TV or I've seen the movies and stuff, and she was so down to earth, so pleasant, was really kind of receptive to, like, as we're talking, just really, I could tell she was absorbing everything and just kind of thinking about things in a really sort of open-minded way. And so it really allowed a great conversation. I could go over all the different options, and we just sat down and had a nice conversation about what choices made the most sense for her.
I agree.
Anything you elaborate on
No.
that?
It wasn't what he would want to do on me, it was what I wanted. He's not arrogant, he's approachable. And that's one of the biggest things I think as a patient is to feel like you can approach your surgeon. So I immediately felt very confident.
She told me what happened, and I imagined it, and then I ended up watching the show just to see for myself. It was even worse than I thought. The mechanism of how she hurt herself is obviously not typical, but it made sense why she would have had some damage. And then in addition to damaging the implants, it also, I think, probably caused a little bit of tissue damage, which created some tightening of the scar tissue called capsular contracture, which has caused some distortion of her breast appearance and also some discomfort for her. So I just felt like there's a lot of things that could be made better in terms of not just aesthetics, but also in physical comfort and just making her feel like her breasts are back to normal again. I appreciate what you said a second ago about the, explaining things, because it's always, for me, really important for patients to be well educated as far as what their options are, why I'm recommending what I do. I don't do anything just for the sake of it. Just based on her anatomy, to have the kind of the shape and size she's looking for, she needed to continue with implants, and that's the decision that we ended up making together. But I like patients to make their own decisions based on the information I give them. So it's the education to empower patients to make good choices for themselves.
I know there's a lot of stuff around implants, but I think that this is the best thing for me. And I love that he's able to take some fat to put around it so that they also have a little something and it feels a little more natural too. So that's something that I've never had before. Surgery's in about 5 minutes. How are you feeling? That's the thing for you. This is like you going to a set and...
It's kind of funny, like, I've done so many thousands and thousands of breast revision surgeries. I don't think about it.
You just do it.
It's just whatever you do becomes sort of it just becomes normal for you, like the stuff you do is kind of crazy when you think about it.
Not as crazy as what you do.
Anyway, I'm not nervous. I'm just ready.
I'm glad you're not nervous and you got a good night's rest.
All right.
It's actually going pretty good. Today's the day after having surgery. I'm in a little pain, but it's bearable. I actually thought it was going to be worse, but so far it's not, and I actually feel pretty good, and I'm so happy that today's today and that I did it. This is my fancy bra. And so they gave me another one. I don't know how long I'm gonna be wearing these. I see the surgeon today. This was the first time that I've ever been put under where I was really calm, because normally I'm shaking and anxious. So I had my surgery, and then the next day I
came in and Dr. Cohen took my bandages off and my undergarments that I have to wear, and I got to see myself. He showed me a picture right after he did the surgery because he wanted me to see what it looked like, because obviously I'm swollen, and I'm so happy with the results. I know I'm swollen. I wasn't as bruised as I thought I would be. Looking at the results just the day after, and now I'm a week out, I cannot believe it. I am so, so happy. I can't wait for bikini season. And I'm so happy I had the fat sucked out too, because I've never done that before. I totally get the whole lipo thing. This wasn't just me getting implants for the first time. He had to do a lot of work on my breasts and also taking some fat from my belly, my flanks, and a little bit on my bra line to put around the implants, which I was so happy that Dr. Cohen did because it gives it a more natural look, and I've never had that before. And then to be able to tighten that skin around my tummy, I'm very happy about that. I knew in my gut and in my heart that Dr. Cohen was the right doctor for me. Dr. Cohen is an artist. He took the time to listen to me and see what I was wanting to achieve. And I think sometimes a lot of the doctors will do the size they want in you. And I'm saying this from experience. I started at 19 and I'm 100 now. So if anyone could go to him, go to him, or do your research and really take the time and feel comfortable. It's your body. And if someone doesn't listen, I think, to a patient, then for me, that's not the right doctor. I just felt very comfortable and calm. A huge testament to obviously Dr. Cohen, but also his team of the nurses and anesthesiologists. So it's the most comfortable I've ever felt.